Hello and welcome to Recovery Machine. I'm your co-host Nathan, joined by my co-host Corey. Hi Corey.
Hey Nathan.
How's it going today?
It's good.
Right on. So this is our going to be our first part of two episodes that we're going to use to introduce each other, and from there we'll talk a little bit more about what the podcast is going to be about, and we will occasionally be bringing in experts and or guests who know more about topics that we're interested in than we do.
Yeah, that's right.
Yeah. So we'll get right to it. This is going to be Corey's introduction part. So we're going to just I'm going to ask him some questions that we've kind of went over previously, and I think they're questions. We both think they're questions that will give you a kind of an overview of what it's like when a healthcare professional gets into trouble with substance abuse, and then what happens with getting back to work and all the politics and legal stuff that goes on with it.
Yeah, that's right.
Okay, so what is it that you do, Corey? What's your profession?
So I'm a registered nurse. I've been specifically an ER nurse for the last 9 years. Nursing for 12 years in total, though. I've worked in larger centers, tertiary trauma centers, and then some smaller sites as well.
Okay. So as an ER nurse, I think they have a bit of there's kind of a hierarchy of command there. And from what I understand, you were kind of the leader or team lead. Is that what they call it?
Yeah, that's right. So I was a coordinator and oversaw the multidisciplinary team, and kind of worked as a liaison with physicians and kind of determined where people would go and navigate people through the ER during their stay, and get them treated as quickly as possible, and then get them home.
Okay. So that's a lot of logistics, I guess. What kind of hours were you working when you were doing that in that position?
For the most part, I worked 12 hours. I would work 7 in the morning till 7 at night. Although occasionally I was known to work 16-hour shifts and stretch the day out.
Okay. Yeah, you nurses are pretty crazy with the with the hours. I couldn't. I'm a pharmacist. I can't imagine. I've done some 12-hour shifts, but 16, I think would. 12 is too much, to be honest with you. 16 would be over the top. So what can you describe? I mean, how long's it been since you worked in this capacity?
I haven't worked in that capacity in about 14 months. So have been home during that time.
Okay. So thinking back to your last few shifts there, what can you give us kind of an idea of what you would do kind of throughout the day, and what your resources and support systems were like in there, as far as, staffing was concerned, and patient load and things like that?
Yeah. So, I mean, this prior to going off work, this was during the pandemic, and it just as sort of things were maybe prior to the crescendo of the pandemic, but it was certainly building, and the staffing issues were growing on a regular basis. So it wasn't unusual that on the course of a shift, I would be doing my coordinator position, but also filling in any gaps within the staffing holes in the department. So that meant I often had a patient load or a partial patient load, and then would be relieving breaks and filling in any other gaps that went on as well.
Okay. So I'm imagining you're, maybe talking to, dozens of different staff members throughout the day, as well as dozens of different patients, I guess.
Yeah, that's right. So in the larger site that I worked in, we would see sometimes up to 150 patients a day. In the smaller site, it would be maybe 40 patients a day.
Okay.
And then managing a team of anywhere on a bad day from 2 or 3 nurses to, on a good, properly staffed day, maybe 5, 6 nurses. And then again, being the liaison with the physician team as well.
Okay. Yeah, I know right now, of course, across the province, probably the rest of Canada too, but BC is certainly having a big problem with staffing shortages with nurses, particularly. Um, so would you say, you're saying the low mark would be 2 or 3? How often, how many days out of a week would you say where you had full staff?
Maybe one.
One. Okay.
Maybe,
Yeah.
maybe one. Yeah.
Okay. So I think if anything, maybe that's gotten a little worse now from COVID.
I think it has. And then, and also there was an increasing regularity of relying on travel nurses that were passing through from out of province, picking up short contracts, and didn't necessarily know the community or know the department, but were expert at sort of learning as they went.
Yeah. That would, it's akin to a locum pharmacist or any locum healthcare professional, I guess.
That's right. Yeah.
With nursing, I think it might be a little different in that it's so, I would imagine it would be more imperative that somebody was part of the team and they're on a regular basis, especially if you're dealing with, in the emergency, I suppose, you're down on the coast there where some of the hospitals are a lot bigger. In smaller centers in an ER, you're probably going to know a lot of the people who are in there. You're going to have your regular kind of recurring people, and then other folks from the community, I guess, if it's smaller. But either way, it's probably helpful if you can have somebody who's been there and knows and fits in with the team.
Yeah, absolutely. It makes a big difference. And knowing the community as well, knowing what's out there, what resources are out there for people, and helping patients navigate to get home safely or get to whatever facility they need to get to was a big part of it.
Okay, cool. Kind of feels right now like for this interview so far, I feel like I'm a defense attorney, and I'm just going through I'm building towards a case of some sort. I don't know what I'm doing here, but anyway, bear with us, please. This is our first podcast.
Yeah.